Welcome back to The Agenda. Joining us now to talk about the ins and outs of the Affordable Care Act as upheld by the High Court this morning is Annette Ravenow, Communications Director for Know Your Care, an organization that supports the President's health care bill. Welcome to the show, Annette.
Thank you so much.
Congratulations.
Thank you very much. Congratulations to all Nevadans. Thanks to this great decision of the Supreme Court. Now we know it's constitutional, and now let's get back to work.
Well, let's look at some of the provisions that are effectively already in place. These are some of the things that have already taken effect. Young adults up to 26 are covered by their parents' policies. There's the ban on lifetime insurance limits. The insurance companies just can't say, oh, that's enough, we're not paying for you anymore. A ban on denying care because of pre-existing conditions. Preventive health care benefits without co-pays or other out-of-pocket charges. Closes the infamous donut hole in Medicare for prescription costs. I'm just reading some of these. Temporary insurance coverage for retirees over age 55 who aren't eligible for Medicare and who meet some other conditions. Health care plans have to report the proportion of premium dollars spent on clinical services. That is, if they don't spend 80% on services, then folks get rebates. Some folks in Nevada have already received those.
46,590 Nevadans are already benefiting from that. Starting on August 1st, they're going to be receiving checks saying that thanks to the Affordable Care Act, they're getting this money back.
Yeah, and there are a lot of other provisions. One other one that I'll mention real quickly is just the employee credits, the tax credits for small businesses.
For small business owners,
up to 35%, 50%, I guess. After
it's going to be increasing, correct?
Now, as I look at these things, and I look also at the release that you folks put out today, that your group put out, and it mentioned a lot of things. The thing that was missing to me was all the stuff that happens in 2014. And it seems to me that this is part of the problem that the Democrats have had in promoting this legislation. They don't talk about really what are the nuts and bolts of this bill, and that is that it extends coverage to people who earlier didn't have it. Instead, it seems to be kind of targeting a bunch of middle-class swing voters who already have insurance. That seems to be where your messaging is.
Well, first of all, everybody's benefiting from the law, one way or another. If it's not directly, it's definitely in a directly way that we will be benefiting from it. Things that are going to be happening in 2014 is that adults, because right now only children cannot be kicked out of their parents' health insurance, but adults would not be able to be kicked out or denied health care coverage because of a pre-existing condition. So right now, unfortunately, they still can, but that's the reason why there's a pre-existing condition insurance plan that they could get, and unfortunately, many Nevadans don't know this. So it's good for them, it's good for us to be in the show, to let them know that they can actually apply for this. If they have been denied, if they don't have health care coverage for the last 6 months, they could apply for this and get this coverage that they need.
But isn't the bigger part of this bill overall, and it seems to me one of the more compelling and persuasive parts of this bill, even if you're a conservative who opposes other parts of it, is that very poor people who previously could not afford insurance and for whatever reason were not on the Medicaid rolls are now going to have hopefully a number of options, although if some of these states opt out of Medicaid, you and I had some questions about what happens then to people below that poverty line.
Well, we need to definitely make sure that Governor Sandoval would want not to opt out and just, receive these funds from the federal government. So what happens to these people?
Actually, can I interrupt you? I want to make a comment on that. Governor Sandoval this morning told Sam Shad up in Reno, just before we came on the air, that from where he sits now, he would not be in favor of the Medicaid expansion.
He would not be in favor of Nevadans. That's basically what it would be.
Well, I think he's not in favor of increasing the cost to the state of about $500 million over the next X amount of years. That's the big concern of those who oppose this.
We're already paying for this. People that don't have health care coverage, where do they go? They go to UMC. They go to, and then who pays for that? All of us do. So at the end of the day, we are paying for this, but instead of them having health care coverage, now they will have to then go to the emergency room and get something taken care of that they could have taken care of before if they had a health care coverage and a general doctor. So people here in Nevada, I was just talking to a family yesterday. They had Medicaid, but their husband, which is the only person that works in the house because the mother is a stay-at-home mother, got an increase at work. So they were celebrating that they finally got an increase. And what did that mean? They now cannot qualify for Medicaid for their children.
Well, and of course, this Medicaid provision is the one area where the Obama law was struck down by the courts. It basically makes it optional. But, as Roberts promoted in his opinion, this is essentially free to the states for the first, 3-4 years, and then the federal government pays 90% thereafter it. That's a lot of money for 10 cents on the dollar.
Yep. Exactly, I agree. It's a win-win situation. I really hope that our governor understands that this is something that we need to do for Nevadans. We already know that there's a lot of our people that don't have insurance.
We will be picking up on this discussion and other elements of today's historic ruling right after this. We're discussing the impact of today's Supreme Court ruling on the Affordable Care Act with Annette Raveneux. She's Communications Director of Know Your Care in Nevada. That's an organization that is allied with the Obama campaign, obviously supports the Affordable Care Act.
She's a fan. She's in a good mood. Floated in here on Cloud 9 this morning. Let's take a look forward at what's going to happen once this insurance mandate starts to take effect in 2014. People will have to show when they file their tax returns that they have coverage, or they'll have to pay a tax penalty. Premium subsidies for low and middle income families are going to be raised and paid for people up to 400% of the poverty level. That's quite an increase there. Insurers can't deny anyone coverage that has a pre-existing condition. Companies with more than 50 workers will have to pay penalties starting at $2,000 per employee if they don't offer a set level of health benefits. Optional Medicaid expansion for people under 65 years old who earn less than 133% of the poverty line, or around $30,000 a year for a family of 4. That's going to affect about 16 million Americans, and state insurance exchanges will be established to help people find insurance coverage if they are not covered through their workplace. And that one of my objections to the Affordable Care Act, and there were parts of the bill that I supported, is this shift in policy where in the past, if employers wanted to provide health care benefits as a benefit, as part of a salary package, as a perk to their employees, they were free to do so, but there was no legal requirement that they do so. Now we're actually going to be penalizing companies if they do not provide it. This is a pretty big policy shift. Can you understand why a conservative person might object to that?
Well, it's only the huge companies. Anybody that's a small business owner, this is the misconception. People think if they own a little mom and pop shop that they only have 3 full-time employees, they have to offer. They do not. Only companies that have 50 full-time employees or less. Or more, I'm sorry, that they will have to then offer health care coverage. Anybody that has less than 50 employees, and that does not count the owners of the company, then they don't have to offer it. These employees then could then go to the Silver State Insurance Exchange, which is what Nevada is doing, in order for them then to buy their own insurance.
And to be fair, I do think most companies of 50 employers or larger probably do already offer health care. I'm not sure what the percentage is of those that will be affected by that.
Right, exactly. Only small businesses, the ones that might not be offering because of the cost, and then now the cost is going to be decreasing.
You know, as I've watched the debate over this legislation and over this issue even before the legislation was passed, I've often been frustrated, as I think many on the left have been, by the White House and his allies' inability to make a cogent argument for what's going on here. You know, Joe Biden, when this thing was passed, said this was a pretty big blanking deal because of the fact that it was covering so many people, and because also those, and I think that this has completely been forgotten, people who can't afford to get insurance coverage are going to get pretty healthy subsidies from the federal government so that they can afford to buy insurance coverage. That seems to me like a huge story here, a huge part of that step I was talking about earlier, moving towards universal health care. Why do Democrats pound this point and explain to people what's going on?
Well, we're a nonprofit, so we just educate people about the new healthcare law. So what I could tell you is that that's what we do here in Nevada. You could go on Facebook, on our page, facebook.com, Know Your Care Nevada, and you can learn about the events that we do, so you can learn more about the law.
And looking at the release that you put out, your celebratory release this morning, oh boy, Obamacare has been upheld, it's going to be constitutional, and it is all these modest insurance reforms that are already in place. No mention in there about the fact that people who are low income are going to get subsidies so that they can finally go out and buy insurance. I mean, why is that not part of the fundamental messaging of this law?
Well, it is. The idea is just for more people to get to know that. So you're right. I will send you another press release with more information about that. So then you could talk about it tomorrow.
Talk about influence. Hey, before we forget, let's talk about those tax penalties and how those how those break down if you don't provide proof of insurance starting in 2014.
Yeah, well, you can see it's $95 for an adult. That's a year, by the way, per year, $47.50 per child. $285 for a family. Comes out to about 1% of family income. These things tier up. In 2015, you can see $325 for adult, $162.50 per child, almost $1,000 for a family, and then by 2016, they go up a little bit further, $625, $347.50 per child, about $2,000 for a family. Now, it should be said that these are penalties that will be incurred on people who do not go out and get health insurance, who do not check that box. Some estimates I've seen suggest that the people who will actually be paying this tax, this is the tax that John Roberts talked about, maybe 1% of the population. What's your estimate?
It's a really, really low percentage. Like you say, it's on average 1%. But everybody that keeps complaining about this tax, all of them have insurance. Every single person that complains about the tax has insurance. And anybody that cannot afford health care coverage will be able to get health care coverage somehow.
And just to clarify, because they have insurance, they will not be paying the tax.
Anybody that has health care coverage will not get that
Annette
tax.
Ravenel, thank you very much for joining us today. Congratulations again.
Congratulations to you too.
Elizabeth and I will be back with some takeaways right after this.